Let me introduce myself. My name is Елизавета Timoфеева. I am a student of Saratov State Medical University, Pediatric Faculty, Course 1, Group 8. I want to tell you about personalized early detection and prevention of breast cancer. Breast tissue comprises mainly fat, glandular tissue, arranged lobes, ducts, and connective tissue. Breast tissue develops in response to hormones such as estrogens, progesterone, insulin, and growth factors. The main periods of development are during puberty, pregnancy, and lactation. The glandular tissue atrophies after menopause. Breast cancers are almost all carcinomas of the epithelial cells lining the breast ducts, the channels in the breast that carry milk to the nipple. Although breast cancer can occur in men, it is rare, less than 1% of cases. Breast cancer is the most common cancer in women worldwide, representing about 25% of all cases in women. Breast cancer is the leading cause of death among women under 15. Every year in the world, more than 1 million new cases of breast cancer are registered. The highest incidence in the USA, Canada, France, Israel, Switzerland, Spain, Finland, the Baltic countries, Australia, and Hawaiian Islands. In 2020, breast cancer accounted for every 8 new cancer case in the world and every 4th among women. 2.3 million were diagnosed with the disease. 685,000 died from it, according to the United Nations. Many different factors can affect your chances of developing breast cancer. There is no one single reason. It results from a combination of the way we live our lives, our genes, and our surrounding environment. Everyone can take steps to lower their chances of getting breast cancer by making small healthy changes and living well now, including drinking less alcohol, keeping physically active and maintaining a healthy weight, limiting postmenopausal hormone therapy. Overweight and obese women, defined as having a body mass index over 25, have a higher risk of being diagnosed with breast cancer. Extra fat cells increase estrogen in the body, and estrogen can make hormone receptor positive breast cancer develop and grow. Research shows a link between exercising regularly at a moderate or intense level for 4 to 7 hours per week and a lower risk of breast cancer. Exercise consumes and controls blood sugar and limits blood levels of insulin growth factor, a hormone that can affect how breast cells grow and behave. Breastfeeding may also protect against breast cancer by lowering the levels of some cancer-related hormones in your body, getting rid of any cells in your breast that may have DNA damage. Smoking, particularly if studied during adolescence, is associated with an increased risk of breast cancer in premenopausal women. Research also has shown that there may be a link between very heavy second smoke exposure and breast cancer risk in postmenopausal women. Improved use of mammography to predict risk is a particularly attractive area of research. Screening programs provide longitudinal data that can facilitate studies to identify such imaging biomarkers. The aim of mammography screening is to detect breast cancer as early as possible, primarily in order to reduce the number of breast cancer deaths, but also to reduce the severity of the disease and the use of heavy cancer treatments. Other promising approaches to improve breast cancer risk prediction include imaging and blood-based biomarkers. Potential blood-based biomarkers include microRNAs, tumor-educated platelets, and circulating tumor DNA. A breast self-exam helps you understand the normal look and feel of your breast. Step 1. Begin by looking at your breast in the mirror with your shoulders straight and your arms on your hips. Here's what you should look for. Breasts that are their usual size, shape, and color. Breasts that are evenly shaped without visible distortion or swelling. If you see any of the following changes, bring them to your doctor's attention. Dimpling, puckering, or bulging of the skin. A nipple that has changed position or an inverted nipple, pushed inward instead of sticking out. Redness, soreness, rash, or swelling. Any unusual discharge from either nipple. Step 2. Now raise your arms and look for the same changes. Step 3. While you are at the mirror, look for any signs of fluid coming out of one or both nipples. This could be a watery, milky or yellow fluid or blood. Step 4. Next, feel your breast while lying down, using your right hand to feel your left breast, and then your left hand to feel your right breast. Use a firm, smooth touch with the first few finger pads of your hand, keeping the fingers flat and together. Use a circular motion about the size of quarter. Cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Step 5. Finally, feel your breast while you're standing or sitting. Many women find that the easiest way to feel their breast is when their skin is wet and slippery, so they like to do this step in the shower. Cover your entire breast using the same hand movements described in step 4. There are many different signs and symptoms of breast cancer, so regularly checking your breast for anything different or new is very important. The earlier breast cancer is diagnosed, the better the chance of successful treatment. I would like to end my presentation with the phrase, "Prevention is better than cure." It should be now a fundamental principle of modern healthcare. Thank you for your attention.